Kia ora tātou, me mai tātou, tēnā koutou katoa. Welcome to this event. My name is Marion and I'm the CEO of Platform Trust. And so on behalf of the Navigate groups, which are all around New Zealand, we just really wanted to welcome everybody to this event. This will probably be the only mental health and addiction focused debate as we come into this election. And I know that there's hundreds of you out there who will be either joining us tonight or joining us later as we go into replay and various other ways of looking at this, that will be joining us because mental health and addiction is an increasingly important part of our lives. It's no longer on the edges. It's absolutely critical and integral to our mental health and well-being, both personally and also for our communities. So before we start, I just wanted to acknowledge a couple of things. The first thing I want to do is to acknowledge the community organisations, the hundreds of community workers out there that during COVID have supported hundreds of people. They've supported people with their well-being, keeping people well, keeping people safe, keeping people reassured, and keeping people on their journey to recovery. So absolute ups to them, because that's what we think has been the backbone of our success in terms of maintaining people's mental well-being during COVID. The second shout out I want to do is to the cross-party political group, and three of them are joining us tonight. I've got a screen, I've got Matt on one side, I've got Louisa there, and Chloe is also with us today. And the other two members of the group, David Seymour and Jenny Markroft, won't be with us, but this is a group of politicians who have absolutely stood up in Parliament, and you will hear tonight that they don't necessarily always agree on things, but they are all standing up for mental health and addiction. So thank you, and thank you for your support. So I just want to say, enjoy this debate, have a good time. We've got lots of questions, lots of stuff to get through, and I want to hand you over to Melissa. Melissa is a well-known journalist, well-known media presenter, and is our chief politician wrangler tonight. So thank you very much, Melissa, for helping us out with this event.
Tēnā koe, Marion, tēnā tātou katoa no maira. Ko Melissa Chan-Green, aho. For those of you who don't know me, I am Melissa Chan-Green, and if that name's not familiar, my name was Melissa Davies, and if that name's not familiar, then you're watching the wrong channel. Just kidding, but not really. I've been with TV3 for about 13 years, and I was with TV1 for 5 before that. So in that time, as you can imagine, I've covered numerous stories about mental health and addiction, and I feel like most of that has been within the last few years, actually. I feel like there has been a lot more volume around mental health stories, and a lot more awareness, but also a lot more issues that need to be addressed too. My family, a number of them work in the health sector, and like just about everybody in New Zealand, I have lived experience of mental health and addiction with family and friends, and can relate to some aspect of this topic. And I don't think there would be anyone really that could say that they don't have some kind of experience in this sector. It's apt that we're talking on Mental Health Awareness Week, and I hope that all of you are doing something for yourself this week and doing something to acknowledge your own mental health. We've all had a difficult and disrupted year, and while we're talking about issues for everybody else, we should also remember that we've got to look after number one. So please do remember that too as we talk about these issues tonight. I'll go through the format first. So we have a lovely panel. We've got 5 on the panel tonight. We have Chris Bailey from ACT. We have Chloe Swarbrick from the Greens. We have Louisa Wall from Labour, Matt Ducey from National, and Maria Meno Kapakingi from the Māori Party. So what is going to happen is they are all going to have a chance soon to have 3 minutes of uninterrupted chat where they're going to outline their party policy. I can't promise they'll be uninterrupted later. And I can't promise that I won't interrupt them if they go over the 3 minutes, but we'll give them all some time to outline their party policies. And then we're going to go into a Q&A. So we already have a lot of pre-submitted questions and we will run through those, but please do submit your questions as we go through as well, because of course there will be topics that come up that you will be interested in hearing more about. Introduce yourselves, please do, in the chat function as well. You'll see that you should be seeing it at the bottom of your screen. So please jump on, say hello, say where you're coming in from, and talk to the other participants. Marion Blake, who you just heard from there, the CEO of Platform Trust, will be able to chat with you there, and as will the politicians as well. Now we can see each other on the panel. We can't see you and we can't hear your audio. So it's not like most Zoom calls that you may have been involved in. This is a webinar, so you're only seeing our audio, hearing our audio and seeing our video at the moment. So play around with the screen to suit you. And as I say, do write any questions you have in the Q&A feature. But if you want to chat, introduce yourself, talk to the other politicians, then write that in chat. We'd love to hear more for you. On the questions, we won't be asking every politician every question, just because I want to be able to cover as broad a range of topics as possible tonight. But what I will do is ask a couple of the politicians to answer those questions, and the others I'll ask to write that in the chat function. And I'll direct you to that function if they've been able to write responses in there. So if you have a question and you write it in Q&A and there's a specific politician you would like to answer that, please just write who you would really like to answer your question. I'm kind of rattling on a little bit about housekeeping because I'm also aware that people will be logging on. And if you are just logging on now and you've missed Marion Blake's talk at the beginning of this, then, or if you miss any of this webinar, then you will be able to see this later on. It's going to be recorded. It will stay on the Platform Trust Facebook page. Will also go up on their website, platform.org.nz. So don't worry, you're not going to miss anything. You will be able to catch it again later. So let's get into it, I reckon. We're going to start with the panel, and just to be fair, the fairest way we thought we could do it was run through alphabetically in party order. So we're going to start with Chris Bailey from ACT, and don't worry, Chris, I will remind people they can catch you again later if they miss any part of your opening address. So you have 3 minutes. Please keep it short if you can, but I will let you know if you're running over, but start away.
Thanks, Melissa. First, can I say thank you for Atamita Platform for inviting me along to speak about the ACT Party's mental health policy. I'm sure you would have preferred to have David Seymour, but unfortunately he's a busy man and he's tied up tonight. And welcome to everyone who's joined us online. The provision of effective mental health care is a priority for the ACT Party. Our Deputy Leader, Brooke Van Veldem, launched our policy platform for mental health at the commencement of our campaign, alongside our overall economic policy. Why do we see mental health as a key area? Around 1 in 5 New Zealanders face mental health challenge in any given year, and as many as 4 in 5 through their lifetime. These numbers are certainly going to get a lot worse due to the stress caused by the COVID pandemic and the resulting financial, social strains on our communities and our people. As a youth aid police officer, I've seen the role that mental health and addiction problems play in our communities. Specifically, as a current teacher in Nelson, I'm seeing our young people increasingly struggling to deal with the pressures they face. While it's good that attitudes to mental health have shifted significantly over the last few years, and people are more willingly to talk openly about their challenges, there's a lot more that must change. I would suggest that our youth suicide rate is one of our darkest statistics. Too often, people who seek treatment describe a system that's hard to navigate. Postcode lotteries incidentally result in particular issues for Māori, and a lack of choice in services and resources to meet their individual and community needs. NGOs openly voice their concerns about a lack of a level playing field and a genuine partnership when it comes to DHBs favouring their own provision of services over alternative community providers. Part of the problem comes from the fragmented inconsistency of standards that occurs across the DHBs in many aspects of healthcare. ACT says that we should put people at the heart of mental health and addiction care and seek to put mental health and addiction care on the same standing as other healthcare. We would establish one standalone nationwide mental health and addiction New Zealand service. This would be allocated the budget currently spent through the Ministry of Health and DHBs on mental health care and would channel it directly to providers of care and ultimately patients through an upgraded system. It would function as a commissioning agency that would assess individual needs and contract the best providers for a person's therapy and care. Of course, it would liaise closely with primary health care and education providers, as they are so often the gateway through which people initially seek help. It would be the one central interface across New Zealand, reducing bureaucracy and administrative burden, constantly reviewing what services are working and for whom. For example, a person will be able to choose any registered provider for their immediate care, giving autonomy to the person reaching out for help, or be referred to a specific provider if they lacked that capacity. ACT's vision is a New Zealand where people with a wide range of needs for mental health services can approach a wide range of services registered with Mental Health and Addiction New Zealand through an efficient, simple to access and easy to navigate system. Thanks.
Thank you very much. And perfect timing, Chris. So that's a great start. That's a point to you already. Let's go to the Greens now and Chloe Swarbrick.
Kia ora, Melissa and tēnā koe. Marion, thank you to everybody who's tuning in, and kia ora tātou as well to my fellow MPs on our cross-party mental health and addiction wellbeing group, Lewissa and Matt, who are here today as well as to the other the candidates for their respective political parties. My name is Chloe Swarbrick. I am, as Melissa just said, the Green Party's candidate for Auckland Central, but have also served, had the privilege of serving as a Member of Parliament for the past 3 years, including as an establishing member of that cross-party group on mental health and addiction. So with this brief period of time to, I guess, foreshadow some of the crunchy questions that we'll be getting into, it's worthwhile to point to one of the kind of key things that saw me ending up holding this portfolio of mental health for the Greens, which was my personal experience with regard to particularly depression. And therein, I have travelled around the country and spoken to a number of particularly younger people, but those in the regions and in urban centres. And what I've heard on the ground has largely reflected the same kinds of things that have come out of Hiara Oranga, the mental health and addiction inquiry, which the government commissioned in our first 100 days. That is that, you know, you can have a biological predisposition towards the manifestation of mental ill health, or its often poor and far more stereotyped and stigmatized cousin, addiction, but effectively your environment can either aggravate or mitigate the manifestation of that mental ill health or addiction. So for the Greens, it's about recognising the importance of those services, particularly that they're culturally appropriate, funded adequately or above, but also that we aren't just looking at the ambulance at the bottom of the cliff here. We're focused on actually improving people's lives from the get-go. Because I very strongly feel, and as has been reflected in a number of research articles, journal articles, but also in our debates behind the scenes in the mental health and addiction group, you know, there are these massive environmental, social, economic, criminal justice factors which feed into this pandemic of mental ill health in this country. So there I refer to the point made by the head girl of Aorere College, Fili, who said to me in Kōrero, which kind of floored me several months ago, suicide prevention is providing people warm, dry homes. Suicide prevention is raising income. Suicide prevention is making sure that our kids get to stay at school and get a good education. Suicide prevention is keeping whānau together. those are the same kinds of things that the Greens are really focused on. I also just finally want to touch on what I think is one of the really cool things that we've also done in re-establishing the Mental Health Commission, and also in the funding that we have managed to bring together, that $1.9 billion. There's still so much more to do in deploying it and planning, however. Looking forward to your questions throughout.
Tēnā koe, Chloe, thank you very much. And yes, if you are just logging in, please do submit some questions in the Q&A. We have some pre-submitted questions already that we'll start off with, but obviously we'd love to hear more from you. So submit your questions in the Q&A and also introduce yourself and have a chat and talk to everybody else in chat. We'll move on now to Louisa Wall from Labour.
Tēnā koutou katoa. Thank you, Melissa, and tēnā koe, Marion. I want to acknowledge Atamira and the Platform Trust, and obviously all of those who have chosen to be with us this evening to discuss mental health and addiction wellbeing. Can I also reinforce that this is Mental Health Awareness Week, and the theme this week is reimagining wellbeing together. And when I think about what that means, actually I think back to this term of government and what we as a government have done to reimagine mental health and addiction wellbeing. And so for us, from the beginning of this 52nd Parliament, we've prioritised mental health and addiction. We, with our coalition partners, obviously had the He Ara Oranga process that led to a fantastic report, and I want to acknowledge the members of that team, Professor Patterson obviously, but also Barbara Disley, who engaged with us as parliamentarians with Marion and asked us to come together across the House. People are sick of mental health and addiction issues being political footballs, and this is an attempt to get some political consensus as we move forward. So obviously there were 40 recommendations from that He Ara Oranga report. The government accepted 38 of those, and I have to say the two that we rejected, well, one of them we've already highlighted in our cross-party work by our Zero Suicide Aotearoa strategy. Essentially, from our perspective, we believe that all suicides are preventable. I'm sure those who are engaged in the submission process appreciated the fact that we included in the schedule of the legislation before the House a focus on Māori, Pacifica, refugees and migrants. I want to mention the Rainbow community because they had support from right across Aotearoa, and it was wonderful to see the coming together to highlight what has sometimes been a community that hasn't been acknowledged in terms of our suicide rate. Also people with disabilities, our rural community, our veterans, our prisoners, and also there was a big focus on young people in the care of the state, and also young people who have experienced traumatic experiences such as family violence, and obviously older people. The last thing I really want to highlight as my introduction, having chaired the Health Select Committee, I also want to highlight from an addiction perspective, we changed the law around criminality. Essentially, we want to treat people who have addiction issues as a health issue. We want a health response from our government. And so it's really good to be able to report that the legislation went through in August last year, but by November 2019, offences had decreased by 30%. And we saw a corresponding number of people referred to health services for support. So the intention of this government is to keep moving in that direction, essentially to treat addiction issues as health issues and not criminal justice issues, and obviously to roll out the He Ara Oranga commitments through the Mental Health and Wellbeing Commission. And I too look forward to receiving questions and with my colleagues answering those to your satisfaction, hopefully. So kia ora koutou.
Tēnā koe, Louisa. Really cool to see so many of you introducing yourself in chat too. There's heaps of people logging in and saying hello, and I think we're going to have a really good discussion with all of the expert minds I'm seeing logging in. We're going to go now to Nationals' Matt Ducey for his introductory remarks.
Thank you very much, Mel, and to Marion, thank you for everything you've done with the cross-party group in Parliament, and for Platform as the Secretariat. just to acknowledge my parliamentary colleagues here tonight and the other candidates. Fair to say we're pretty comfortable talking to groups of people, but on the Zoom it's very strange looking at yourself while you talk, and I still find that hugely off-putting, but I'll push through it. Just to acknowledge everyone who has logged in to be part of this session tonight. I think it's very important, and as Marion outlined, it appears to be the only mental health and addictions focused debate. So I'd like this to be as interactive as possible. There was a comment from Mel about, you know, the prevalence of mental health and the discussions within politics and media. And last week I travelled down to the south of the South Island. I was in a small town called Lumsden, which is just out of Gore, and I was speaking at an event organised by Ag Proud in a wool shed, and it was attended by a group of pretty hardcore farmers. And I just thought to myself, you know, would have that happened 10 years ago? Would have that happened 5 years ago? Farmers taking the time out of their day to come out and talk about mental health. And I do feel the time has come for mental health. Politics is the art of timing. And I think if we come together, like we have in the 52nd Parliament, but come together in the 53rd Parliament, we can make a real long-term change. That's not to say whoever's in opposition shouldn't be holding the government of the day to account or taking an adversarial position. That still has a very clear role. But equally, I feel as though from my 6 years in politics and travelling around the country as New Zealand's first standalone mental health minister, Freudian slip there, first standalone mental health spokesperson for the National Party, people want us to work together. You know, we've got a lot of things to argue about in politics. Maybe mental health is not one of them. And I do hope that we can truly work in a bipartisan way to really set long-term solutions that go longer than the 3-year parliamentary cycle. And I look forward to debating them tonight.
Thank you very much, Matt. Interesting, you're mentioning there the rural response and chat about mental health. I was talking just with my colleagues this week, and the most watched story online ever for News Hub Nation has been a story about mental health in the farming sector. So of all the stories that have played out on News Hub Nation, that's had the most views for us online. So interesting point about the chat going on in that community. Last but not least, last by alphabetical order, we have from the Māori Party, Maria Mino Kapakingi for her introductory remarks.
Ai kia ora tātou katoa, kanu te mihi, kia koutou e te Māria e whakatata mai ana, whakarongo mai ana ki a tātou I tēnei te rōpū kōrero. Koutou ngā rangatira, tēnā no tātou. Ko Maria Mino Kapakingi tēnei mihi atu ana ki a koutou mai te tahi tokerau. Ko hau te tahi tino tino kaimahi o te tahi tokerau. And I'm standing for the Māori Party as the candidate in minister in waiting. So anyway, having a bit of fun with that. Kia ora everybody. So I guess when I'm listening to the openings, Melissa, it takes me back to 2012 when Tai Tokerau suffered one of the highest spikes of suicide in Te Tai Tokerau. And I go back to that because I worked in the team that worked through that for at least 7 months. So, and I'm still in that work. So I've worked in this space for more than 44 years. It's more than a subject. It's something that I do every day. I'm currently at the moment supporting 5 separate whānau that are struggling and working their way through these things. And all of these whānau are Māori. So our Māori health policy is all about whānau Māori, hapu Māori, iwi. So I guess I want to open in that way by saying that it is certainly for Te Taitokero, it's one of our most serious and saddest situations. You would know just before COVID, we've all, you know, everything happened in March 22nd for Taitokero and for the whole country, right? But in a small town in Taitokero, we had suffered 3 deaths virtually a week after another, all from suicide. So, and Taitokero had already suffered 12 suicides in 12 weeks in our own rohe. So it is a big issue for us. It is a serious issue, and we've got some plans for that under the Māori Party. So we launched our Māori health policy, and you're gonna hear it as you know, as our own approach to it. So oranga whenua, oranga tangata. So we're not approaching it like we're divided up into issues of addictions or diagnoses. That our wellness as people is related to the wellness of our whenua. So oranga whenua, oranga tangata. So I'm going to go straight into the policy, but just to say that this aligns with all of our whānau first policy, our whānau bill policy, which we're about to launch in the next couple of days, our mātauranga education policy, and our te reo policy. And all of those make Māori sense and are all connected to one another. So what we plan to do is establish a Māori Health Funding Authority. And under that, so it's a Māori in control of the health spend for Māori. Right, so we're looking at 5 billion, which is 20% of the 2019-2020 budget. And so again, we're saying, look, we know what it takes to do this. We've been doing it through whānau water. We know what our people think, want, and deserve. And frankly, what we're having to deal with and what we're having to put up with are failings of Pākehā systems that just don't work for us. They just don't work. So we're saying we're ready. We're saying we're prepared, and we're saying we're able and determined to design and develop for ourselves, and we're ready. You would have seen that in the COVID time in Taitokero. Our own whānau water providers, our own hapu and our own whānau got up, got organised and delivered for themselves. We didn't wait for any agencies to come to the party to do anything. Eventually they did, but we actually made it happen for ourselves. So in a you know, perverse way, COVID has reflected and reminded us we are the ones that we've been waiting for. We are not waiting for any other system. And in fact, we need that system to get out of our way. And that is essentially a Pākehā-led system, which is what we're having to tolerate now. So so setting up a health funding authority, so be the boss of our own dollars, of our own health. To implement a Māori health card. So for me or any Māori that wants to, look, I want this kind of service and I'm going to that service because this one over here just doesn't get me. So having your own Māori health card to be able to buy and have your own health literally in your own hands. In terms of, and I've delivered this kōrero in terms of the mental health and addictions now, because inside of our whole health policy. And why that's important is we're not divided up into take, Māori, we are whakapapa. So oranga whenua, oranga tangata, we're whakapapa. So to describe it this way, it's not simply just to talk about mental health. It's to talk about things like deculturation. Why do we have it at all? Why are young ones making the saddest and most terrible decisions, right? And then why? Because unfortunately the systems just don't understand us. So deculturation, that's the disease. That's the disease of our time. A kaupapa Māori mental health service, that's what we're doing. That's what we want to do. So our own mental well-being comes first for us as Māori. 500 million per annum to that. So it's just a straight transfer across into Māori hands, Māori determination and Māori pedagogy and Māori systems. And finally, a drop Māori cancer screening by 10 years. So, I mean, it makes sense, right? If we're dying 10 years earlier, maybe we should get that assessment and that preventative care 10 years earlier. How about that as just a smart idea to keep Māori alive? Anyway, kia ora tātou.
Tēnā koe, Mari Meno. Just to let you all know too, Pauline from Platform has posted a link to that suicide prevention report, the cross-party group. So that's in chat if you would like to read that report. The link is there. Also, I saw Chloe Sawbrick posting her contact details, because of course there may be questions you still have for the politicians at the end of this. So keep an eye in chat, because if the other politicians also want to post contact details for you to contact them afterwards, all that information will be there. Now, as I said, we have some pre-submitted questions. We also have people submitting questions into the Q&A. So if you have a question, please submit into the Q&A. And please, if you can, specify which politician you would like to answer that specifically, and then chat away in chat. I'm going to start first of all with quite a general question. I should also say that if you're just tuning in now, that this is recorded and it's going to go up on the Platform Trust Facebook page. So if you missed any of the introductory remarks, that will all be there for you to see later on. This is a question that came through earlier, and it's quite a big and important question. So I do want all of you to answer it, but I want you to keep your answers brief. So mental well-being, as we know from the He Aro Oranga and also the Zero Suicide Report, is widely recognised as something that is not just solved by addressing mental illness and distress. So what will your party do to address the coexisting problems that people may have alongside mental health and addiction challenges? And these are things like the relationship with poor physical health, poor dental health, lower rates of employment. That is a massive topic. So if you can please just pick perhaps one policy from your party that you think will have an impact on mental health and addiction as a kind of interrelated issue. And we'll start with Matt from National.
Thank you very much, Mel. I think fair to say, if we take COVID in the context of a COVID-19 environment, I mean, now more than ever, we've seen the connection between a strong economy, lowering unemployment and increasing incomes on mental health. And if we think about, what is mental health, the ability to handle stress, we really need to build that resilience within the community. In the Epidemic Response Committee, Sir Peter Gluckman clearly outlined 10% of people who lose their jobs and or incomes are going to develop PTSD, it's serious mental disorder. So we should always, to your point, be working to treat mental illness, but in a parallel work stream, we should be focusing on building mental well-being. And I think for me, it's how do we potentially move larger than the DHB structures to resource people who are at the grassroots now. Go back to that rural community story. If a lot of those rural people don't engage in health services, what are the on-the-ground rural services now operating that we can resource to deliver life-saving suicide prevention work, but also mental well-being and resilience work as well?
Louisa Wall.
Thank you for the question. I probably will focus on two areas. One is homelessness, and obviously the correlation between homelessness and people with mental health and addiction challenges. And so we've prioritised that through the budget, nearly a $200 million allocation in that space. But I do really want to highlight the HIP and the health coach, the new positions. So the health improvement practitioners that we've rolled out based on a pilot in Auckland in 2017. So they're currently in 54 GP practices across 11 DHBs. And the aspiration is for them to be in 100 GP clinics by July next year. And essentially what they do is provide immediate support. So within GP practices, we will have the resource available so people can be referred to these health improvement practitioners and also health coaches. And one of the things I did want to emphasize is that we can add value to those positions, I think, by broadening and including economic wellbeing, for example. There's been quite a push about highlighting people with mental health and addiction challenges also being unemployed. and therefore I think the correlation with poverty is absolutely correct, that a lot of the people that we're wanting to support actually are marginalised because of historic stigma around people with mental health issues. So I think and I want to agree with Matt from his earlier comment, mental health has reached its time. You know, ko e whakamā, we shouldn't be whakamā or ashamed anymore if we have struggles to do with traumas that we're all facing. And probably one last thing I want to focus on is our Mana Ake program that we started after the Canterbury earthquakes and also in Kaikoura, because we knew of the trauma faced by our young people. So we prioritise rolling out health and education, working together to assist traumatised children. And I actually think we haven't seen the full impact assessment of that, but that should be rolled out or could be rolled out nationally based on the evidence that it works. So we know our kids are living in trauma, whether it be family violence issues or living in poverty with parents who are dealing with the stresses of that. And so as a solution moving forward, I think that probably is one thing that the cross-party group can highlight and work on together if it's proven to be effective. So kia ora.
Kia ora. And so to go to the other member of that cross-party group, the Greens, Kore Sawara.
Thank you. So I'm assuming that we'll probably have a question later about the likes of service delivery, so I won't get into that. The question was, you know, what is one policy that will make an impact on kind of those co-factors that lead towards mental ill health and addiction? So on that, I think for the Greens, it's our poverty action plan. You know, what we can do in this country, one of the wealthiest countries in the OECD, is if we want to, if we have the political willpower to, we can end homelessness and we can end poverty so that nobody lives below the poverty line. So our poverty action plan effectively says that if we were to require the top 6% of our population to pay a little bit more in their taxes to contribute to the society that enabled them to get to that position of wealth at the top of the pecking order, then there is the opportunity for us to raise the floor, so that every New Zealander does not earn less than $325 per week, noting that the current core benefit levels are $250. I here as well refer to, I think it was 2014, 15 or 16, a report from Auckland City Mission, which followed around 100 different families, and one kind of instance stuck out to me of a single mother and the hoops that she had to jump through to retain her core benefit, to get things like food parcels, and effectively the hard work of retaining poverty. So for us, it's about removing those barriers so that people have that dignity, to have that autonomy over their lives, to look after their whānau, and in turn to give them the opportunity to have genuine choice. Because it's all very well and good for us to talk about choice without realizing that it's a construction of our environment. And we know, you know, that mental ill health and addiction are largely driven by factors such as poverty, isolation, and trauma, which Lewis elucidated on earlier. And therein, enabling people to remain connected as part of a community is of critical importance. And one of the best ways to do that, to provide people with stability, to make sure that they aren't transient in homes or in jobs, to make sure that their kids remain in a full school term, a full year at school and onwards, and to see that people are able to get their roots down, to know their neighbours, to form that sense of belonging and identity. Eradicating poverty is a key factor for us.
Thanks very much, Chloe. Can we hear from Maria Meno from the Māori Party?
Kia ora. Eradicating racism would probably be the single most and a key, and I think it's too easy to dismiss. It floats off into space where it's, well, if we do these and that's going to deal with racism. So I just want to make that statement. In the question, it talks about addressing coexisting problems. So again, even the question itself is posed in a Western framework. It's posed in a Western science. See, mātou te Māori, right, when we talk about ourselves, kua piringia ngā mea katoa te tahi ki te tahi. Everything is intrinsically and forever connected. So the minute you separate it up and break us all up, then you failed straight away because you're applying a Western science which worse than fails us, it knocks us off. Right? So then often we're having to translate and interpret for every GP or every well-meaning, I guess, in the main mostly, but still not enough to be able to respond to the issues that are, whether they're coexisting, whatever the words are, they just don't get us. They don't get us. They don't get Māori. So I'm saying, isn't it funny to set up programs that then you go outside to fund others to come in to work with the GPs or wherever, where you've already got the best source of health and wellness for Māori, and that is their own whānau, and that is their own hapu, right? So why do we keep shopping for all these other, programs or that are, some of them are from home, but most of them are from overseas, that again, we're having to tussle and fit ourselves into. So I guess I am saying, and we as a party are saying, until that's fundamentally understood, that the analysis, the paradigm is a Māori paradigm. It's a Māori analysis. It's a Māori solutions. So it's not, it's not like 80-90% Pākehā solution with a little bit of cultural advice on the side, because that's what's happened. The minute any provider, any main monostream provider gets a cultural advisor in, we're stuffed. We're stuffed, because we're having to, we're having to interpret. So, I take my moko to the doctor, right? It's a Pākehā doctor. I have to do more work. My moko's sick. I have to do more work so that doctor actually understands who it is we are and what's happening, both at a wairua level, at a tinana level. You see, and I mean, I don't know how many people are actually going to get what I'm talking about, and that's the issue. That's the biggest issue. And so every day, Māori carry the mental load of all of this, which is racism as usual. Business as usual, racism as usual. So, koina taku whakahoki kōrero kia koutou e Melissa. Tēnā tātou.
Kia ora, Maria Mino. And Chris, final word on this question, then we're going to move on and I'm going to allow some interaction.
I'll be quick. Being a teacher, and having one policy, and as you said, I would suggest that ACT's charter school policy would fit very well into helping at-risk students, those students who face truancy issues. These schools are set up to help kids who struggle in mainstream school and often have issues themselves at home and with other teachers, to be in a specific environment for their needs, I think would be a great thing for the young people and their mental health.
Very good, thank you. I'm going to now go to a question from Taimi Allen from Changing Minds. And I'll direct this question to Louisa and Matt for this question, but the other politicians, do feel free to interject if there is something you really want to say. Otherwise, please do also write your response in chat for people to see. The question is, from Changing Minds, as I said, it's a national lived experience organisation. Looking forward to hearing from the candidates how they're going to forward the people at the centre recommendation of He Oranga and ensure the peer and lived experience workforce is prioritised. Louisa, if we can start with you.
Well, thank you for the question. Actually, I want to pull up the information that Platform sent to us about the NGO sector. Actually, in the 240 providers and 63.8% of non-clinical roles within the sector that is provided by people, tangata whaiora, who have a lived experience of the mental health and addictions wellbeing area. I think that their involvement in providing those services are vital. And I didn't introduce myself in terms of my history in the sector, but I used to work for what was originally Rākau Water Trust that became pathways. And so I know Jackie and Julie very well. And I had 12, I used to call them residents of the trust, actually, that I was responsible for interacting with. And our philosophy was always that our residents know what is best for them. They have the answer, they have the solutions. So very much in line with what Miriam Meno said, actually our whānau have the solutions to what our needs and aspirations are. I think what we're trying to do, and what we've been trying to do for a long time, is to destigmatise. And obviously if you go back to the 90s and the institutions that were closed down, and then we had to house people in the community, we've kind of been evolving from that space to it being actually quite normal for people throughout their lives to experience trauma. That means they have anxieties, they may go through bouts of depression, and that they need to be supported. So the voice of people who have experienced, you know, all those forms of trauma, whether it be PTSD or anxiety or trauma, I think it's becoming more and more critical that they are involved in the sector and that they play a central role. And the reason I highlighted the statistics from Platform is that it seems that they are engaged from an NGO perspective, and I think the reason it was highlighted was because of the funding issues, and we're not actually valuing the contribution of our tangata whaiora, of those with lived experiences, enough. We don't see their expertise in this area as clinical expertise. And so I know moving forward that a lot of these initiatives cannot work and will not work unless they're run by Māori, they're run by Pacific, the construction sector is involved, the rural sector, our ethnic and migrant communities. So the reality of Hiara Oranga and the reality of the legislation and the schedule means that we wanted to give voice to those communities that want to look after their own, like the rainbow community. And I think we don't have the solutions, but our providers do, and our whānau do, because they're the ones who are intimately involved and have the trust and the relationships to help that whānau through whatever trauma they're going through, to live healthy and well lives. And they will also be the people that are there with them after they experience that a mental health episode or whatever it may be. So from my perspective, we can't do the work that we want to do in transforming the whole sector unless we forget about prescriptive kind of interventions and don't just hand resources to whānau who provide us with the solutions that they believe will work for their communities.
Kia ora. Sorry, I asked Melissa if I could say something very briefly in response to this question. Tōtoko the points made by Louisa, but I guess the 2 cents that I wanted to add is to change the way in which currently the Ministry of Health and DHBs look at success as a model. And for me, you know, I think about the conversations that I've been having behind the scenes with MOJ and MOH officials, with Mr. Stuart Nash and Andrew Little, and formerly Dr. David Clark, around particularly the program in Northland, collaboration between DHB and police to effectively decriminalise methamphetamine. And the fact that it has been such a struggle to get more money for that program, Te Arooranga, because the MOJ and MOH just simply don't recognise it presently as successful. And I think that is plausibly because it looks at things through a te whare tapawha, you know, summation jury kind of model, and it doesn't quite necessarily align. The outcomes are following people throughout their entire journey, so it's not immediately the same kind of Western prescription model of saying we've serviced this many people and, you know, we've then kicked them out of the system, they're healed. It's in fact about following people through their lives. The other thing would just be about actually also making sure that contracts have greater certainty. So in the first 100 days when we first came into government, I was contacted by a number of different mental health services in regions across Aotearoa who had real challenges because they had been told by their DHBs and by Ministry of Health that whilst the mental health and addiction inquiry was underway, their contracts wouldn't be renewed, particularly the two that I fought really long and hard for were Golden Bay's Te Whare Mahana and the East Coast Te Wata Wata. And, you know, the kind of corralling that it took to secure the extension of the contracts of these community services that had spent so long establishing themselves in the middle of a freaking mental health crisis was just phenomenal. So changing the kind of outlook and approach therein, where you don't need to have to look to establish a community organisation that services people's mental and addiction kind of well-being, where you also need to ensure that you employ one or two people from a position of kind of constantly having to fundraise philanthropically or applying for government grants, but you actually are able to use those services that EFTS as somebody who is able to service your community too.
Thanks very much, Chloe. Before I go to Matt, I just want to point out there are some direct questions to panelists also in chat. So just reminding those of you panelists to check in there, because there will be some people who are asking direct questions of you. But Matt, if I can get your response to this question, and then we'll move on.
Yes, thank you. I think in response to the first point about putting people at the centre of their care, when we look at that scathing report by the Chief Ombudsman, quite rightly it was picked up around the facilities issues. But actually, if you delve deeper into that report, it was still quite shocking by the very low number of patients or service users who are actively involved in their care planning and even actively attending their care planning. I think that shows that there's still some way of addressing the issue, I suppose, in the professionalism of making sure, whether it be medical workforce or others, that when we work with people around mental health, it's less of doing something to them, but getting alongside them and working with them. And I think, you know, we talk of the recovery model, getting people to take some responsibility in their care and choosing what's best for them. And I think that's one of the strongest points with peer-to-peer and lived experience. You know, people can get alongside each other, but get alongside people a lot earlier. Because of course, when I talk to my local St. John's guy out here in North Canterbury, when he goes out to a mental health crisis, quite often he'll spend a few hours sitting with that person. And when he talks through with them the story of what's happened over the last few days or several weeks, there's been plenty of points where potentially someone could have got alongside that person a lot earlier and prevented that person from getting into crisis. So I think part of the issue there for me is structurally. I think we've got to look at how we ensure every region in New Zealand has a joined up, integrated and seamless network of services. And they will be, you know, your early intervention, they'll be your mild to moderate, severe, enduring. But at each step along that continuum, there should be some peer-to-peer or lived experience engagement that people can choose to engage with.
Thanks very much, Matt. A question here from Kelly Feng from Asian Family Services, a familiar name to me from some stories I've done recently. So kia ora, Kelly. I'm going to ask Chris Bailey and Maria Meno Kapakingi to answer this, as we haven't heard from them recently. So if you can please answer, what is your opinion on the community dependency on POKI funding, which takes from the poor and most vulnerable communities in New Zealand? For those of you on the panel who aren't answering this, please do write your comments in chat. And if there's any burning response that you would like to make, also do let me know and feel free to interject. We'll start with you, Chris.
I think as a police officer, an ex-police officer, I often dealt with those issues. It's not only pokies in those areas. The the increase in bottle shops and the more all of those sorts of things that that the community entices to entice them, and I certainly think there should be much more regulation on where those where they are placed.
Okay, Maria Menor.
The question, I'm not sure if I'm reading it. The question is more a morality around, should we, you know, if this is where the money's come from. I'm not sure if that is it. It's been a long-standing issue, you know. Should we really, because we're robbing from the poor and then giving, you know, it's that kind of a dynamic. And very often for NGOs and small, medium, it's a real tough one, and often you compromise certain things to actually be able to access it. It's as if it might be so significant, that particular piece of funding, that you have to compromise. So it isn't an easy one in that way. So if the question is earlier than that, which is, Chris, what you've replied to, then of course regulate it, or like just get rid. You know, it's we can be more responsible and more proactive, surely, and just own up to the parts of it that we should just own up, take control of, and regulate or reduce or completely get rid. And yeah, as I say, it's been a long-standing take. Should we, shouldn't we? And my experiences working inside of providers for the last many years, and it always felt awkward, you know, but sometimes that was probably the only thing that was going to get them to be able to pay their staff to make those calls, get out on those cars and do their thing.
If I may just, and yeah, absolutely, tōtoko the point made there, my Miriamano. So I have been advocating behind the scenes, particularly with Jan Logie, on this point to disentangle funding from pokie machines to community, particularly arts and culture, because what you end up with is a perverse incentive and over-reliance on that funding to be generated, which then in turn justifies the provision of more pokie machines and a less and less, or rather a more and more harmful environment, and less of a focus on harm reduction or harm mitigation. So for us, it's about actually recognizing that with all of these kinds of things that can be addictive, whether it is gambling, whether it is substances like Chris was speaking about with regard to alcohol or otherwise, it's about striking the right balance with regard to regulation. And I'd also say, Chris, awesome to see that the ACT Party is advocating for sensible regulation.
Can I just comment too, because I actually think the question from my read of it was about the reliance on additional sources of funding, which is what pokies and other forms of funding actually are all about. NGOs don't have sufficient monies from government to fully fund their business or to meet the needs of their clients. And I think that is a vexed question, like how much should the government contribute. In some sectors it's quite prescriptive, like with hospice, you know, it's almost like a 60-40 split, and that's been that way, I don't know, for a very long time, where the government provides, you know, 60% of the funding, but hospice is reliant on getting philanthropic money to make up the difference so that they can basically provide the service, and the same in this area. And I think if this is rather than a nice to have, but a fundamental, and if mental health is so fundamental to the well-being of New Zealanders, then I think what is an appropriate balance between you know, contributions from wider New Zealand society versus directly from the government. So yeah, Matt, have you got an opinion on this, or have you been looking at this specifically? Because a lot of our NGOs, the reality is they're having to top up the contracts that they get from government from other sources.
Yeah, I think it's fair to say if you know, addictions is always felt the poorer second cousin of mental health. Well, gambling is even the step further from that. And I think, in a sense, we're growing the evidence base and we are growing the awareness of it. Like all things, some people can undertake a behaviour recreationally, and unfortunately for some people, whether it be using pokie machines, that can form an addiction. And quite rightly, there needs to be some responsibility on the facility that has the machines as well, to put protocols in place to identify those people and making sure they don't undertake in that behaviour as well. Of course, there is ability for some community groups not to choose to take POKI funding as well, and we are seeing more of that and deciding ethically that they're not going to accept POKI money anymore. However, I accept that if you are a community group and you are struggling for funding, and this pub charity funding or other avenues come along, I can see why you would be interested in it as well. And I think we should be making sure that if we look at our makeup and network of services, that we've got to ensure that we have those parity of addiction-based services across the country, because quite often, and many people on this panel tonight, when you do travel around New Zealand, you come back to that point where some regions seem to do it really well and some don't. And then you get this huge postcode lottery in New Zealand, whether it be for addiction services or mental health services. And so the question comes back to, in a country of the size of New Zealand, how can you have some more centralized focus to ensure that the people responsible, in this case it might be the planning and funding departments of DHBs for mental health services or looking at addiction services, that we standardise to make sure everyone has that parity of access.
Thanks very much, Matt. I'm seeing too in chat, if you'd like to see more about this, they've posted the report from PFG and the Salvation Army on the problems with the dependency on funding from POKIs. And going back to the question that Kelly asked, I know Kelly will be asking this in the context of gambling addiction being an issue in the Asian community. And I just want to ask another question about specific ethnic question, and this is a question for Maria Mino. I appreciate your comments about the Western perspective on mental health being unhelpful for Māori, and it makes me wonder if it is the same for people of other cultures within New Zealand. Do you think Māori-led services could at some point be broadened to receive referrals for tau iwi if they were interested in this, or do you think it needs to be limited to Māori only?
It's he pātai pai tēnā e hene tēnā koe. Far be it for me to say that what works for Māori is it's perfectly for everyone else either. That's I'm Māori, and that's my main gig, and that's really where where we derive and drive our thinking. So if the question is, could we work together? Is that I mean, sure. I mean, whānau order is a perfect example of a commissioning model that works for Māori, that's set and designed and functions, and the latest report, brilliant report, all working really well overall. But there's nothing stopping anyone to access that either. So there's already that opportunity there. But actually, can you just, the beginning of that question, Melissa, can you just repeat that? Because I think there's something quite important in the opening of the question.
It said, I appreciate your comments about the Western perspective on mental health being unhelpful for Māori, and it makes me wonder if it is the same for people of other cultures within New Zealand.
Right, yeah. It might be, but it's worse than unhelpful. It is devastating, it is destructive, and it is absolutely part of the destruction. It employs and deploys deculturation. So when you have a system and processes and protocols that continue to not recognise, ignore, and diminish Māori beings, then yeah, it's more than bad thing. It's a destructive thing, and it is part of why we're having to put policies like we have together and said, okay, that's enough tātou mai, that's enough. We won't put up with this any longer. We are coming through, 7 of us saying that is enough. We want to be the boss of all of our things. We want an independent health authority, funding authority. We want an independent kaupapa Māori mental health kaupapa. you see, and none of these are accidental ideas, where these have been already, you know, happening, and we've been pushing NGOs, Māori NGOs particularly. So we've been working on this for a while, and we know it works. So, you know, it's, you know, currently the health system, it's bad for our health, just saying. We're not the, you know, addictions is the poor cousin to mental health. Māori mental health is the poorest of cousins to any of it. And that's why we're here to say, ka nui tēnā tātou mai.
Chris, a question for you. How do you propose that ACT would make sure that mental health and addiction services were available for all groups of people in New Zealand? So we're talking about people with disabilities, people who are older, migrants, people with learning disabilities, the deaf community, the rural community. How do you ensure all those groups are catered for?
You're not talking, not specifically mental health, is that right?
Mental health and addiction services, yeah.
Our policy, MHANS, Mental Health and Addiction New Zealand, it would integrate all of the agencies, private agencies, and distribute those to where they're needed. That would include all sorts. Whoever where the need arises, they would become on the list of agencies to which those people would be referred. Whether it's it's currently CAMS are for the young ones, that it may be another more suitable agency who could do the job as well or better, will come on board. Or and the same with all Māori old people, those would be on the list, and MHANS would direct that person to which agency would suit them best.
Are there any panelists that also want to answer that or respond?
Yes, no agency, it's a Pākehā agency, will do best for Māori, Chris. It won't. It's we tolerate what we get now, We tolerate it. We have to bear it. So that wouldn't make sense to us. It wouldn't fit with what we're trying to move for. Yeah, it's because it's much of the same. It's much of the same. Even with best intention, it's still much of the same.
I'm not saying they would be Pākehā. Māori agencies would be on the list, so they would be run by Māori.
Great. Kampai.
I just wanted to highlight, oh, sorry, Matt, I just beat you to the punch. I'm sorry.
Go, Louisa, I'll go after you.
Oh, thank you. I actually have a meeting tomorrow with mates in construction. And there was a news item about, you know, the increased suicidality of people, of men actually work in the construction sector. And this initiative has been developed by the industry itself. And so the solution to some of the issues isn't going to be driven by a motivation from government to provide the answers. It has to be driven by our communities. What we need is a responsive government, responsive funding entities who are then going to, you know, add value to the motivation from within, in this instance, the construction sector, to find the solutions for themselves. And essentially what they have is champions on those work sites, men who have become vulnerable and talking about suicidation or suicide attempts, all because of the stress, pressure, and a whole lot of other events happening in their lives. And so, you know, it doesn't matter what sector we're talking about, whether it's the rural sector, farmers, whether it's the rainbow, you know, I mean, and from my perspective, Māori have a different position. They are our tangata whenua, you know, they are our treaty partner, and they will always, I believe, have and should always have the right to determine for themselves the provision of services for our whānau, for our hapu and our iwi. But I also think those principles apply right across the board. I know there are issues in the Asian community. We've had increased suicides. The people who have the solution to delivering for the Asian community are the Asian community itself. So it's how do we support the development of capacity within that community to then have the people who are trained enough, and actually from a base of those who have experienced mental health and addiction issues, because the clinical might not have the clinical expertise yet, but actually we have people with lived experience that we should be basing some of the service development around. And I think that is the solution going forward. And how do we support that better to enable delivery on the ground? Because the delivery in institutions or by government will never work. And that's why I believe He Ara Oranga, as a blueprint for moving forward, has put people at the centre of our response. And so I do look forward to what will happen in the future, because we've never had this opportunity before.
Are you going, Matt?
Yeah, I'll jump in after Louisa. Look how well behaved we are. Anyone would think we get on. Hey, first off, I'd just like to say I agree with Louisa about the idea that no government can respond to this, nor should be totally responsible or accountable, because it's easier to say, oh, well, it's the government's fault, they need to do something about it. This is the whole of New Zealand's issue, and equally everyone needs to step up and play their part. And what we are now getting to, I believe, is a real mature discussion at that grassroots. We use the word multi-sectorial in the cross-party suicide prevention report. What would work around suicide prevention for young Māori in South Auckland would be very different for farmers in maybe Lumsden. And I think for me, the role of a government, and I'm very much interested in the report Closing the Loop, which is around that stepped care model. We all have a lot of differences and will come in through multiple routes, but some of the commonalities is, engaging in universal services about well-being and health promotion. A small group will need early intervention, mild to moderate, severe to enduring, and then hopefully moving back down those levels as well. And I think it's incumbent on any government to actually start to say, from a more central level, what is the agreed network of services along that continuum in every region. And not only that, but I think there is a role, whether it be maybe the Mental Health and Wellbeing Commission, to actually be reviewing or auditing, whatever verb you want, each region to say, where are your gaps and what are you doing about it? Because, I just wonder, each government puts more and more into mental health. We have ring fenced, but, I just want to make sure there's an agreed network of services. There'll be some tikanga Māori and youth appropriate in a range, but all that funding's going in, and if not, how is each region addressing that? And I think for me and the National Party, we're very clear. We think the mental health system needs to be managed better, and it needs to be down at a level where someone is taking responsibility and accountability of it.
And
Chloe, I will come to you. Sorry, I know you want to talk, but I also just on the point of gaps, and we're talking about delivery of services by the right people for the right job, but a good point is about issues of the workforce. And so a question from Fiona, Chloe, if you would answer this as well. One of the biggest issues that we in the mental health and addiction sector have is workforce. What strategies would your parties introduce to address this issue and increase the workforce?
Kia ora. I'm not sure if that was Fiona Trevelyan who I saw on. Awesome, yeah. Kia ora, Fiona. We've done a bit of work together on particularly reform to Section 7 of the Misuse of Drugs Act, which Louisa referred to earlier. Was a big battle to get that done behind the political scenes, but glad that we have and that there's more underway. So in terms of the kind of pipeline of workers, I think one of the key things is planning, workforce planning, and that is something which I understand was beginning to get underway in the final part of the tenure of Dr. David Clark in his position as Minister of Health. So interested to see where that ends up being picked up by the new Minister of Health. I'd also say that kind of the stopgap right now for mild to moderate and where we can urgently get more people on the ground is through peer support. And we've seen that with the efficacy of the Piki pilot program, wherein getting a bunch of people with lived experience who have training of, I believe it's between 6 to 8 weeks, and in turn are paid the living wage to support those who are experiencing mild to moderate kind of symptoms. So the other thing that I just wanted to speak to in terms of, I've addressed that hopefully, of the immediate urgent ability to get people on the ground servicing, but also the need for workforce planning. I did, however, think that there is quite a good connection here to the point around responses to communities, and particularly diverse needs of communities. And I was actually just reflecting on how, when I first received the mental health and addictions portfolios in the Green Caucus, I did a tour of universities around the country. And I remember being at a hui with 150 people, imagine that, 150 people in COVID times, in probably 2018 at Otago Uni. And a wonderful, incredible wahine toa of Pacifica young woman stood up. And she said, look, it's all very well and good for you as a Palangi to come here and say that we need, diverse communities servicing their own people and you're going to fund them or whatever. But, there's one Pacifica mental health nurse in Otago, and if I go to her, the whole whānau knows. So actually also recognising that there is, you do introduce different layers and levels of challenges, particularly for those who are in regional communities or those who are, diverse or different in their communities. Here it's worthwhile kind of pointing to, for example, rainbow support services in our rural communities and the likes of, ensuring that we are catering to and caring for people's intersectionalities. So on that, I actually do think that there is a whole lot of value in stepping away from the very prescriptive, medicalised model of mental ill health and addiction that, Hiara Oranga attempted to unpack. And instead, we engage in a far more te ao tikanga Māori lens of te whare tapawha. Again, I think that would do a whole lot better to service people across Aotearoa than the present very Western pharmaceuticalised model. I also just, finally, in summing that point up, want to speak to the fact that our young people in advocacy right now for greater mental health services are actually experiencing pushback. So, Chris, I understand that you're from Nelson. You may have come across a fantastic young woman named Zoe Palmer, who a while ago was campaigning for the retention of CAMS, child and adolescent mental health services. And for particularly beds and particular services for those young people. The DHB was quite intent on cutting it and putting young people into the adult services because they were certain, based on what we were speaking to before, the very problematic KPIs that they were looking at, that younger people could be serviced through the adult system. And Zoe spoke to her experience as though in publicly advocating for it and speaking to her lived experience, she received letters and comments from officials and people in elected positions telling her that perhaps she might not want to speak about those lived experiences of depression, self-harm and otherwise because she was putting her future career at risk. So I just really also want us to reflect on the cultural cognitive dissonance that we have that requests that our younger people in particular reach out and speak out when they're experiencing problems, but then simultaneously tells them that if they out themselves as weird or as struggling, then they may just experience greater pushback or stigmatization as a result. So there's a lot of things interrelated in that, and I won't talk about the pipeline of mental ill health, but yeah, I hope that that's somewhat useful as a contribution.
Thanks, Chloe. There are a lot of questions on the Hedda Simpson Health and Disability Review, so I want to move on to that. This question is from Daryl. Matt, I'll go to you first on this. I would like to ask about the Simpson report. Heather Simpson indicated that there needed to be significant structural change to the health system to resolve the issues needing to be addressed. Can each panelist comment on what major structural change to the health system they will implement, if in government, and how these changes will impact the mental health and addiction sector? So Matt, if you'd like to comment on that. Other panelists, feel free to interject. We're kind of going to want to move on quickly through the topics now. So if you've got something to say, please do jump in.
Yeah, it'd be fair to say I could probably respond to that because it is in the broader context of health and our health spokesperson, Dr. Shane Retty. has spoken, I think, to the real point, if I could drill into that question, Mel, the way I'm interpreting it is to, do we need 20 DHBs? And I think the report has talked about reducing from 8 to 10. You know, we haven't backed that. We have urged the government to actually say what DHBs will be merged. For me, as the mental health spokesperson, it's probably fair to say at this point, which I probably should have brought up earlier, if people think I haven't been clearer about National's mental health policies, we were to announce our mental health policy today, but yesterday I got a bit of a sniffle. In today's world, I was told to take a test and confine myself at home, and that's where I am now. So we actually had to cancel our mental health policy announcement this morning.
So you can do it now, Matt, go on.
Yeah, that's always career limiting. But I will be announcing National's mental health policy with Dr. Shane Retty next week, and there will be a policy around this. It's fair to say, I think, in my previous comments around the need of some more centralised view of how every region provides a joined up, seamless and integrated level of care, specifically in mental health and addictions, whether you want to be that stepped care. But I think that's where we would focus, not necessarily around the DHB structures, but how at least there is removal of that postcode lottery for mental health and addiction services across regions in New Zealand.
Louisa, was that your reading of the huge structural change to the health system that needs to come about as a result of that Heather Simpson report?
Well, yeah, so fundamentally it was about whether or not we should reduce the number of DHBs, but also it did suggest the creation of a Māori Health Authority. But between the Ministry of Health and the Māori Health Authority was the development of a commissioning agency. And I know there's been a lot of kōrero that there should be a parallel. So you should have a Ministry of Health, a commissioning agency, which is generic, and then a Māori Health Authority, and then a Māori commissioning agency to ensure that we have services that are fit for purpose in terms of kaupapa Māori. That for me is probably the biggest area of discussion. I think the DHBs, we've already had some economies of scale, to be honest, across Tamaki Makaurau. So we have counties Manukau in my area, Waitemata, Auckland and Northland already collaborating on a number of things. So the reality is reducing the numbers is fundamentally about efficiencies in the system and having a more coordinated and targeted approach. I think we have to be mindful, though, when we create, they will become big entities, or obviously that the populations that each of the DHBs currently serve, I think everyone just wants to be reassured that services will be available where they live. And that is probably the biggest issue. If you create, you know, a big DHB that used to have 4 DHBs within it, and you have a central location for particular services, where are they going to be? Who's going to be the lead DHB? And then it's those challenges that through engagement we'll be able to decide. So none of this has happened yet. It's obviously a proposal, and it provides an opportunity obviously for the mental health and addiction sector to be very clear about what they expect if there is going to be a centralisation and a reduction of DHBs in terms of how services are delivered in their community. And it might not matter if we are decentralising further and allowing the community to be the providers, because in theory people should be able to access services where they live. And that's what we want fundamentally, is for people to be able to go to the sports club, to through their work, actually, through the places that they live and interact on. The services need to be supplied to them where they live, and not needing them to travel long distances to be supported.
Melissa, so you know the value of calling a report he ara oranga, you may as well have just called it whānau ora, really. You know, it's and that's the serious. I mean, that sounds kind of cute, but I'm serious as hell, because when we use our own wording and our own concepts, it's a big deal. We're owning the whole space. We're owning it. And so under the Māori Party, that's really, we're like, okay, this report, this all of the detail in it, that's relevant, that's Māori detail, we're ready for that. That you know, this is perfect timing as far as we're concerned. I think the Simpson report, perfect. I mean, one of the things that we are pleased with that it's set the authority up. Though Dr. Paparangi Reid said, well, what she was suggesting was it didn't have any teeth in it, eh? It was a toothless tiger, I think was her phrase. So what we are proposing in our Māori health policy is that we're the teeth, and we're certainly we're the teeth for our kaupapa, which is Māori health, designed, delivered, and evaluated and enjoyed by Māori for Māori. So I wanna speak to that. If I can just pop back just a wee bit, you know, when we were talking about suicide prevention work, and I remember in 2012, and this is about rangatahi, 2012, a group of young people designed and came up with their own idea, their own suicide prevention. I mean, it wasn't even called suicide prevention, they called it RAID, right? RAID, to raid the minds of young people to choose life. They had their own, they had some quite unusual things which I was completely like scared of, because I was the GM trying to rail this in, you know. And I remember my CE going, hey, you know, yeah, it was like, because they were young, they're smart, they're full blown, you know, Indigenous Māori young people, and they came up with the RAID idea, and when my CE saw it, he just said, hey, Mino, just give them the funding, provide them the protection. But this is the most important thing, and I guess this is what I'm saying about in our time now, is to get out of their way. So I did get out of their way. They did protect, and they provided really a cultural imperative to it, with a clinical sort of, if you need it, it's there. But the cultural imperative was the key, and clinical response was, if we need it, it's there, Mino, make sure that you've got one of those and one of those on board. And we made that so. So I guess here we are now, right, in 2020, that's pretty much what we're saying, you know, the boss to be able to determine, define, and deliver to Māori by Māori, and just everyone, and, you know, hand the resources over too. And there's some numbers there which we can talk about later, and then get out of our way with love. But it's like, we've got this, you know. And I'm not, and it's funny, I'm not asking people to trust us. I don't really mind if they do or not. We are the ones we've been waiting for. We're good to go.
Very much. Kia ora, Mari Mino. I just want to turn back to He Aro Oranga, and I want to give you a chance to chat, Chris. If I can ask, what is your plan to implement the recommendations beyond simply just more funding for treatment and services?
We don't believe that our model needs more funding. It just needs directing in the right place. And a centralised agency that knows where each agency is in each community, who they look after, and as far as funding goes, we would do it with the available funding that goes to the DHBs.
Matt, do you agree with that no more funding is needed?
Could you just repeat that question, Mel? Sorry, I didn't.
Sure. The question is, what is your plan to implement He Aro Oranga recommendations beyond simply more funding for treatment and services? But just wondering too if you agree with Chris there.
Yeah, the first thing is, and it's, you know, our social investment approach. It's very clear you need to do things earlier and up front. So it comes back to that principle. Yes, we do need to treat mental illness, but of course, in a parallel work stream, we need to be promoting mental well-being and resilience and building that capacity in our people. Because of course, the better we do that, the less, or hopefully the less mental illness we'll have later in the life course. So we do need to pivot. And fair to say, it comes back to that sense of the theme tonight around timeliness and people are aware. I think New Zealanders are really open to that message, and it's just how we get that message into different groups. So being a Canterbury boy, I'm really mindful of the It's All Right campaign after the earthquakes, you know, and having that sort of interactive social media campaign that drives people to social resources, e-health, e-tools, and things like that. Because I think ultimately, if we can get that right at the grassroots, then we're really building capacity for the future as well. And a key part of that, of course, is young people. And part of this debate, I believe, is driven by a young generation who now have the vocabulary to talk about mental health that my generation never did. They're highly articulate, they're facing less stigma, and they're very open to talking about their mental health needs. And I think they're really driving us forward as a society. And I think we need to ensure that they're given the skills and the coping mechanisms to go forward, because they are literally the next generation. So putting things like those programs in schools, Lewis's talked about Mane Ake as well. It's just getting that resource, and I keep using that deliberately, to the front line and to the grassroots. And I think we need to make sure the resources get there.
There's a lot of agreement between yourself and Lewis there. It's just, it's not as exciting as I was hoping.
I can give you some sparks if you want, Melissa.
Yeah, go for it.
Well, I mean, in Hiara Oranga, you don't only have recommendations for greater funding, you've got a huge amount of recommendations around measurement. You've also got recommendations around legal changes, particularly to the Mental Health Act, but also notably to the Misuse of Drugs Act. And here, I mean, I guess is just a call to action for other politicians all across the aisle. You know, we all have acknowledged that addiction is kind of the poorer cousin of mental health, and we've all acknowledged the stigma here today. But I haven't seen all too much in the way of action or even rhetoric from other political parties, except for Matt, unfortunately, your party coming out wholesale in opposition to a harm minimisation, health-based approach to treating cannabis as a health issue as opposed to a criminal issue. So, you know, the attempt to repeal and replace the Misuse of Drugs Act is something that's reflected as a recommendation in Hiara Oranga, but also in Te Riki, the Criminal Justice, Safe and Effective Justice Review. And that recommended going a step further. So I'm hoping that these reports don't just sit on the shelves, but actually used as a basis for legal change.
Excellent. I just want to pick up back on that grassroots question. So, Louisa, if I can go to you, Matt was talking about that. I want to know what your party, what Labour will do if elected to ensure more mental health and addiction services are delivered in the community instead of in hospital settings.
Thank you for the question. I'll have to, I did get a little bit of briefing. I'm not like Matt. I'm not technically, we don't have a mental health and addictions portfolio. It's within our health remit. I chaired the health committee, and we obviously have a minister of health and associates. But this kaupapa was something that I was incredibly passionate about, which is why I am our representative on the cross-party group. But I am aware of a number of initiatives. One of such is the Addiction 101 and the Mental Health 101 programs. And so we have an aspiration for 8,000 extra places over the next 4 years. And these are delivering in clubs, sports organisations to undertake these programs so that we can better understand and then are better able to support people going through mental health challenges. I mean, it is part of our workforce plan, but we had quite an interesting petition this year by young Lucy McSweeney, who came to us having experienced mental health challenges in high school, and actually challenged us about treating mental health resilience like we do with PE. PE is compulsory. People get opportunities to play sport and have a whole lot of resources in that area. And she was saying mental health is just as important, and why aren't we as young people given the tools that we need to navigate life essentially? And so we've made a recommendation as a health committee that the Ministries of Health and Education have to work together and develop curriculum to ensure that mental health issues are more generally spoken about, that we provide everybody who goes through our public systems with the tools to be able to not only mitigate their own mental health challenges, but also recognise it in their peers and be able to support them, but also seek help and more specific help if that is required. And so I think the whole taboo about speaking about having a mental health challenge, whether it be related to what's happening at home or relationship issues or body image issues, many of our young women these days, there are big issues and anxieties about how they're supposed to be, how they're supposed to look, and who are they supposed to talk to about those issues. Actually, they need to talk to the people who are closest with them, which are the people who go to school with them. And so providing the skills for, I guess, a more transparent, honest environment where people can just be vulnerable. And that is the reality of people seeking help. They're making themselves vulnerable. And what we need to say is, you're not vulnerable. We will offer you, we will tautoko you through, and we will also provide you with the services you need to get you through whatever the challenge may be at this particular time. And that's relevant everywhere. I mean, there's stresses everywhere in different workplaces. And so I think what we're creating, I think, is it's an environment that's conducive to supporting people through whatever challenge that they may have without the stigma, the historic stigma that used to attach to people with mental health challenges. We used to lock people away, and they used to be institutionalised. And we've seen some of those stories come through the state abuse inquiry, and reading them on a daily basis is quite horrific. But we're at a point now where, as I said before, koe whakamā, there's nothing to be ashamed about. And unless you speak up, or unless you've got people around you who understand the signs. And for me, it goes back to the title of our cross-party report, Zero Suicide Aotearoa, because we believe every suicide is preventable.
Thank you very much, Alyssa. There are a lot of really good questions coming through both in chat and Q&A, so I encourage panelists to look there and respond to all of our attendees when they can, but it won't be long, and I'm going to ask you all to do some very short closing statements, so just be thinking about that.
Mel, can I just make a suggestion? Is Pauline there? If she's able to collate all those questions, then we can collectively respond, or we may individually, but everyone who's asked a question, apologies for not replying, but we're quite engaged, and it's hard to reply and listen to colleagues, to be quite fair.
Absolutely, it is very hard, and they're coming through quite quickly, which is great because there's a lot of engagement, but they obviously go up and kind of get lost. So I'm sure there will be a way that we'll be able to look back at these messages and get in touch with people. But as I say too, please have a look. If you're one of the attendees, please have a look through that chat function, because I know the panelists will have put contact details in there too, and that will be a way that they'll be able to contact you and continue the conversation. And Pauline is saying that yes, there's also lots coming in, lots of questions through on Facebook as well, so platform will collate those and you will be listened to. Another question here from Helen Lockett, and I'll go to you, Matt. On this, the Simpson review of the health and disability system highlights that compared to other OECD countries, New Zealand has an above average life expectancy at 82 years. But we know many New Zealanders do not enjoy this longevity in life, particularly people with lived experience of mental health and addiction issues, many of whom will die before they reach 65. Preventable and treatable physical illnesses account for the majority of this premature mortality. What steps will your party take to achieve physical health equity for people living with mental health and addiction issues? And Maria Mino, I think I'll come to you on this after Matt, and if any other panelists would like to kōrero, just let me know as well. sorry, so Matt, if I can start with you, what steps will National take to achieve physical health equity for people living with mental health and addiction illness?
Can you hear me now?
Gotcha.
Oh, good. Sorry, could you just repeat that? My headset cut out.
Sure thing. Maybe Maria Mino, I'll start with you and then we can come to Matt afterwards. But the question is, what steps will your party take to achieve physical health equity for people living with mental health and addiction issues?
So I'm going to bring that in a Māori paradigm, obviously. So oranga whenua, oranga tangata. All right, so just in an opening, when I can see myself and my beautiful awa just around the corner, when I can hear our manu just buzzing, and in our ngahere things are just booming, and when they are well, then I am well. So when we talk about, if the question is about physicality or the physical wellness, I roto I tā tātou nei whakaaro Māori, I roto I tā tātou nei ao Māori, so in our world and in our reality, they are one of the same. They exist in the same way. So so those things are part of what we've built into our health policy and our whānau first policy. And so then just to move on from there, so wellness for Māori is it's tied up in what we call whānau and whakapapa. So my wellness, my mokopuna's wellness, my tupuna's wellness are all again part of the same thing. So I'm just on the question. Whānau is the key. Whānau is so workforce. When you're just talking about workforce before, Melissa, whānau are their own workforce. Whānau force, hapu force. They are their own solutions, ready to be taken seriously. Actually, we saw it in COVID. I saw, 22 different hapu groups having their own pandemic plans, right? They didn't wait for anybody to get that happening. They already got their plans up, and, constant Zooms and just saying to us, okay, we've got our plan, Mono, what are you going to do next? What are we going to do next? So I guess to the question, I'm describing the way in which Māori feel well and be well, and it's connected to having whānau. So no individual Māori is on their own. No rangatahi exists on their own. They are part of a greater group. So that's koinei taku Melissa. They're all whānau hapu iwi. Though that's our model. That's our reason for living. That's our reality. Koiara.
Tēnā koe. Matt, so, and just a reminder for those listening, the question is about preventable and treatable physical illnesses account for premature mortality rates in New Zealand. What steps will National take to achieve physical health equity for people living with mental health and addiction issues? And I think we're going to make this the last question. There are so many there. I'd love to cover the topic of alcohol there, talk more about community NGOs, but we are going to run out of time. So I'm going to make this the last question, and then I'm going to ask each of the panelists to sum up or just have some closing statements with anything else that they'd like to add. Matt, we'll go to you first.
Thanks, Mel. Two things I'd say to that. One is understanding the driver of those physical and health issues within the people, the community of people with mental health issues. So I think we can learn from the Whānau Ora model. It's around how we are better wrapping around services with that population. I think one policy that Dr. Shane Retty has announced so far is that National will put a social worker in each general practice, and that is looking at the wraparound services and connecting with the wraparound care. And I think we need to look at that, whether it be, better housing, nutrition, or other associated issues. The second point I'd raise would be the barrier to engaging services. So something we looked at the Health Select Committee this term was many in the mental health community were not engaging with their GP to get their flu vaccination. And the question was, can we allow pharmacists to deliver that flu vaccination who seem to have a better pickup with some in the mental health community. So it's making sure our services are probably more assertive outreach, they're a bit more responsive, and go that extra step, because I think too easily there's a barrier to engaging a service, but equally we're not looking holistic enough as well.
Thank you very much. And thank you very much to all our panelists and attendees tonight. I knew we were not going to get through not even a third of the topics that we want to discuss, but Pauline from Platform Trust is going to collate all of this, all the messages in chat and the questions on Facebook Live as well. So the panelists will still be able to see those afterwards. We're going to go to some closing statements, and I'm going to go to Chloe Swarbrick first.
Sorry, my parliamentary computer was having a bit of a freak out. So yeah, I mean, in summary, I think we've heard tonight that there appears to be a high level of consensus in our parliaments. However, this is what typically I've found happens in politics. On a rhetoric basis, there usually is consensus on what the issues are, and there's some really great platitudes, you know, things like the ideas of well-being and treatment and all of those kinds of buzzwords that we all know and love because they mean things. So I guess the takeaway that I can give to our listeners, those who've joined us today, but also to my colleagues across the aisle, is that we can't let these remain as platitudes. We have a lot of work to do in front of us. And I guess kind of for me, it's a real challenge to all of us to engage in the really controversial issues as well, particularly where the rubber hits the road on those really hard things in the alcohol space, where we are going to have to beat back lobbyists, in the pokies space, where we are going to have to beat back large corporates like Sky City, in the drug space, where we are going to have to get past massive moral panic and fear-mongering and easy scapegoating rhetoric to say things like we're just going to go hard on drugs. So looking forward to what we end up getting to with this mental health addiction wellbeing group that we've established in Parliament. Really, really proud of the work that Marion and Pauline and the crew at Platform has done in helping wrangle all of us in our diaries together, and the production of that first report. But again, reports are ultimately meaningless if they are simply shelved and don't end up producing greater work. So to those who are listening, please don't leave politics to the politicians. Use your platforms, your voices, your experiences, and hold us to account. Kia ora.
Kia ora, Chloe. Thank you very much for joining us tonight. And can I go to Maria Meno from the Māori Party next for summing up?
Kia ora tātou katoa. Sure you weren't meaning platitudes from me. I'm quite sure you weren't referring to me.
Not at all, Ihoa.
Just to be clear.
A lot of what you're going to say.
But engari I rungi I te aroha ki a tātou katoa, kanu te mihi ki a tātou. Yeah, I guess what we're prepared for and what we're readying and lining up for, the Magnificent Seven of the Māori Party, is that we are determinedly and the liberated voice for Māori. That is so we're Māori through and through, the seven, and then the other 70 of our whānau that support us, and 700 and more that back us. So and what's comfortable about that and what's important about that is that we don't answer to any other opinion except a Māori one. So that's he mea nunui tēnā. We're not tinkering on the edges anymore of what's going to make the difference for Māori. We are the difference makers. We're ready for that. So our steps are going to be big, bold, and brown, right? And preparing you all for treaty reality coming your way. So big love to everybody. Kia ora tātou.
Kia ora. Thank you very much, Maria Meno. And Chris, we'll go to you next from the ACT Party. Oh, Chris, are you with us? Okay. let's go to Matt from National. We'll see what's happening with
Can you
Chris.
hear me?
Oh, let's go to Matt from National.
Sorry.
We'll come back to you, Chris.
Thanks, Mel, and thanks, Marion and Pauline, for platform for putting this on, and everyone who's attended, my parliamentary colleagues and fellow candidates. I'm quite excited. I'm quite optimistic for mental health and well-being in New Zealand. I think, in fairness, most New Zealanders now know that we need to look after our mental health as much as our physical health. And I think it's incumbent on us to give people the enablers to take control and to do that. For me, I'm the National Party's first standalone mental health spokesperson. Next week, hopefully I've got you interested in our first standalone mental health policy announcement as well. I know Louisa and Chloe, they won't say it now, but they'll be tuning in, I guarantee you. But just to give you a bit of a flavour, National's very keen to better manage the mental health system. We believe there needs to be more frontline services to respond to the growing demand in New Zealand. National's very keen to support New Zealanders to better manage their own mental health. We think the true rewards are only when people are able to take back some control and ensure that they get the wraparound services and support that they desire. And equally, we're very keen to better manage the causes of mental well-being at the grassroots. I think that's where the most difference can be made. And I've spent the last 3 years touring around the countries, and boy, the feedback I get is community groups, NGOs, all of the above are primed, ready to go and to make a real difference. And I just think whoever's in government, if we can unleash that, New Zealand's going to be a better place. So looking forward to following up on some of the questions later on. Thank you very much.
Great, thanks very much, Matt. Now, I think Chris, if I remember rightly, is battling some poor internet in Queenstown in a hotel. So he may be coming and going. We'll try and, oh, Chris, do we have you?
Yeah, sorry about that. This motel internet's giving me a bit of trouble tonight. Thanks, Melissa. Yeah, look, mental health has got to come from within. It's it's self-esteem. The individual has to feel good. I think there are a huge number of things that work together to make that happen. One in particular that I just quickly mention, I own a business. I employ 30 people, and it is business is tough, and it is very difficult to. There's so much red tape, so many things that make it difficult to run a business that and employing workplace is really difficult. And I think we need to be good to business, especially during this time, so that they can be encouraged to employ people and really start moving, but we can start recovering from this COVID. The current system of mental health hasn't worked, and we.
You're battling there, unfortunately, with some bad internet, I'm afraid, Chris. I'm sorry to interrupt you, but we'll go to Louisa, and if you're still there at the end and want to say anything, we'll come back to you. But Louisa, I'll just give you a chance to have your final say.
Well, tēnā koutou katoa. Firstly, to my fellow panellists, can I acknowledge all of you? We're all here representing our particular political parties, but for some of us, I know that we're proud to stand in the space of advocacy around mental health and addictions wellbeing. This isn't an area that any of us should feel whakamara about. It's something that we should be proud about, that we're part of a movement that's trying to address an issue that takes over 650 New Zealanders every year. Meno, kia ora to you. I see we've got some whakapapa connection. And I was going to say to you, actually, when we launched at Parliament, Whae Moi Milne was one of our speakers with Sir John Kirwan. And that was incredibly valuable for us as a cross-party group to have such an esteemed person as Moi with JK. And I hope you know, and everyone else knows, and certainly from Platform and Marion's perspective, the treaty is incredibly important to the work that we do. I really want to take the time to thank the over 2,000 people who went to the 400 meetings across 26 locations around Aotearoa, New Zealand, and the over 5,000 submissions that Ron, Barbara and the team received from our whānau, people who spoke up and had their voices heard. And essentially we are all here because of those whānau, those people who chose to participate in a process that produced a report that has led to the development of a Mental Health and Wellbeing Commission and also the establishment of our cross-party group. That was a recommendation from that Heara Oranga report. And so I acknowledge that because without the community and without the NGO sector and those who are involved in this sector coming forward, using their voices to hold Parliament to account, we would not be here. But we also have an opportunity. We have obviously a framework now to build on. And all I can do with hand on heart is say that I'm here to be an advocate for our sector, to speak up on behalf of our whānau who need us to listen to them, actually. It's time for us to listen and to allow communities to take ownership of issues that the system, the bureaucratic system, has not found a solution for. So it's not business as usual moving forward. And Matt, I wish you all the best with your launch next week, quite sincerely, because your party has prioritised your role. And I know from your own perspective, you're incredibly passionate about this whole area. And so I want to acknowledge you because it's only worked because we've all come together. And Chloe, I know what you were doing behind the scenes to make sure that we as a government took on the recommendation. And just to remember, there were only 2 recommendations that weren't agreed to or partially, or that we said we'd commit to further investigating. One was around the 20% target. And obviously we've reframed that and said 0 suicides because every suicide is preventable. But the other was around the sale and supply of alcohol reform that happened in 2012. Not all of the recommendations from the Law Commission were implemented. And I know that continues to be one of the biggest issues. And so I pledge to have meetings going forward about that recommendation. That didn't just come from nowhere. Actually, alcohol plays a big contribution, and particularly when people are attempting suicide. So there's more that we need to do. And I think the discussion is only just beginning. So thank you to everybody who's tuned in, and to colleagues, enjoy the rest of the campaign. I'm sure we're all having fun. Kia ora.
Kia ora.
And thank you to Melissa. Sorry, I loved your work.
Oh, thank you, Melissa. Thank you. Yeah, I just apologise for not getting to everybody's questions. The great thing, though, is probably on Facebook, on Platform Trust Facebook page, you will still be able to add your questions. So because these are all being collated, even if you're watching this later, because it's going to be recorded and go up on the Facebook page, you can still add some questions and get those to the panelists. Chris, you pretty much did get to the end of your closing statement, but the internet was pretty dodgy. So if there's anything you want to say just very briefly to finish up. I'm not actually sure if we even have you now. No, it's not looking good. Any questions for Chris, we'll have to pass on later, and hopefully he'll be able to respond to you there. So please do add any questions that you want Platform Trust to collate. It's really awesome to hear a lot of the cross-party work and the discussion that has been going on and seems to be continuing. So I look forward to see what will happen in our next government, whoever that will be. We will watch very keenly, and thank you all for your participation this evening. And this won't be the end of our discussion, I'm sure. Pō Mārie.
Ka pai, pō Mārie.